Got to get set up. Okay. Is it ready to go?
Yep.
Okay. Okay, roll call. Everybody on? Am I on?
All supervisors are present.
Okay. At this time, I'll ask if there's any other citizens' comments? Any other citizens' comments? Any other citizens' comments? Hearing none, we'll move on. I have no announcements. Any supervisor reports?
Supervisor Berg.
Supervisor Berg?
I'd like to speak on two items here. First, from the governor, he put forth a proclamation of Election Hero Day. Whereas free and fair elections play an essential role in our democracy in ensuring that every Wisconsinite can vote safely, securely, and without fear of intimidation is critically important to the well-being of our communities, our state, and our country. And whereas while we understand that election administration is never an easy responsibility, we acknowledge the unique and unprecedented challenges of COVID-19 pandemic and how the work of our local clerks, election officials, poll workers, voter education groups, and postal service workers has been complicated. And whereas, especially with recent events calling the security, integrity, and character of our state elections into question, Election Hero Day provides Wisconsinites with the opportunity to honor our election heroes for their commitment to upholding Wisconsin's fair and free election process by promoting voter engagement, participation, and protection, ensuring voters have the information they need, and ensuring that every ballot is counted. And whereas our election heroes never fail to display courage, flexibility, resilience, and dedication to facilitating safe, secure, and successful elections, even in the face of a global pandemic that presents additional risk and concern for health and safety. And whereas today the state of Wisconsin joins all Wisconsinites in expressing our sincere gratitude and appreciation for all those who work tirelessly to protect the integrity of our electoral system and provide safe, secure, and accessible voting experiences for folks across the state and country. Therefore, November 1st being Election Heroes Day. I want to personally thank our clerk's office, for what they've done through the recent elections. It's been great to know that the work gets done, and the work gets done amazingly. So thank you very much to that office. I also want to put making if everybody didn't hear it on the radio, if we still listen to that, three recently were named semifinalists. 3 students from Kenosha, Kenosha County, from Kenosha Unified School, seniors that were named 2002 National Merit Scholarship semifinalists in the 67th Annual National Merit Scholarship Program, which was announced on October 26th. In their applications is information about the semifinalists' academic record, participation in school and community and activities, demonstrated leadership, abilities, employment, and honors and awards received. I find it wonderful to say this because one of those requirements is the community activities. And we have a gentleman that is on our youth and governance, Joshua Cow, who is also on the legislative committee. So I want to commend him and thank everybody here that's helped him along the way. So thank you, Joshua Cow, and that's all I have, Mr. Chairman.
Thank you. Supervisor Gunch, did you have your line up?
Adjust to make sure everybody can hear me. I just want to take this opportunity. I know I gave a dry recitation of what we did for 4 days over the budget hearings, but I want to take this opportunity to thank the staff for the preparation of the budget and the work that they put in. I'd also like to thank the supervisors that came that are not on the committee. That's always appreciated, all the questions and interaction. It is a plus to the committee to have everybody there. And I want to thank the Finance Committee for its work it actually accomplished. I mean, we were there till 11:30 one night, so they did a good job, and I just want to thank them. So thank you very much, Mr. Chairman.
Thank you. Any other supervisor comments? Seeing none, new business.
New business, Resolution 74, one reading from the Human Services and Finance and Administration Committees, a resolution to modify the Division of Health's 2021 budget with ARPA funding designated for public health. From the Human Services Committee, Belsky, nay. Berg, aye. Rose, aye. Gully, nay. Beth, aye. Decker, nay. Lewis, aye. From the Finance Administration Committee, all voting in favor, Gentz, Ron Frederick, Celebrity, Kubicki, Franco, Uhas, and Wamble.
Supervisor Berg.
I move Resolution 74.
Moved by Supervisor Berg, second by Supervisor Gentz. Supervisor Berg on the motion.
So many of us have sat through about 3 meetings for this, and one of the questions was the numbers that were being presented in there, and it was provided today to the Finance Department in a very detailed way. So I appreciate that. There are 3 sections to this resolution. The first one, which is the American Rescue Plan Coronavirus Fiscal Recovery Funding, that is ARPA funds. It is not ARPA funds that the county got of that $32 million. This is separate funding. The COVID-19 vaccination funding, again, it's not ARPA dollars, this portion here. And the third one is CDC Workforce Development Funding. This, too, is not ARPA funds. The bottom 2, which is the vaccination funding and a CDC funding, well, I should say all 3 of them, actually. The way it's processed down to us is from the feds provide the dollars, and then the state provides the dollars to us, which is then distributed, like I said, distributed to the county through an algorithm or through a math problem, I should say, which is largely based on population. If there are any questions, I think Dr. Freiheit is here. Otherwise, the Human Services Committee and Finance ask for your approval.
Thank you. Supervisor Rodriguez, you have the line on.
Thank you, Mr. Chair. Just looking at the roll call of this, it was a very close vote at the Human Services Committee. Through the chair to any of the 3 dissenters, just curious as to why you voted against it. Yeah. Do I need to repeat what I said? No? Okay.
This is Supervisor Belsky, Chair of Human Services. I felt there wasn't enough preparation. I did not receive information prior to receiving the resolution. I felt it should have been broken down into 3 separate resolutions. I think that there has to be accountability with regard to how the money is going to be spent. I felt that it was lacking that accountability with descriptive information of how it would be used, whether it was for staffing or other resources. So that was the reason that I voted no for it.
Thank you. Any other questions?
I guess I'll just give time if any of the other 2 supervisors want to explain why they voted no.
Supervisor Gully?
I'd say the same thing. It sounds as if what Supervisor Berg said, that data was provided tonight. I wasn't able to attend the finance meeting, but sounds like maybe it was addressed, but it was the same for me, lack of details.
Thank you. Supervisor Gens, did you have your light on?
Chairman, I'll give a little clarification to that. The Finance Committee also deferred this because we felt it would get to the board and there would be the same questions. And we also had issues with what it was going to be used for. I understand that it's a pool of money that it was awarded to the county, so ultimately we should take it, but we should also know what the plan is for that money. And on the Finance Committee, we did not feel that we had that information. So that's why we deferred it, and we took it up tonight. And a plan was provided to us that was it was detailed, comprehensive, and I was very satisfied with it. And I would have been the first one that would have said no if it wasn't. So it was taken care of, and the plan presented did clear up a lot of our questions. So that's what I.
Any other discussion? Let me come back to you, okay? Supervisor. You want to, go ahead.
Thank you. Just want to add, I didn't turn my mic off. That was done for me. Just to go off of what Supervisor Gens said, this, and if the answers were provided tonight, that's a good thing, but I just want to highlight that I feel like this is a revolving door of this county board not getting the necessary information it needs from administration at the get-go. I feel like throughout the last 2 years of this term that we've all been seated together, this has happened time and time again, where there's a proposal put forward, then it gets put on hold, and in the meantime, us, the supervisors, are made out to be the bad guys for not just approving stuff, for it to come back, and then we have to explain to our constituents, okay, this is why it had to be put on hold. That would be my message to administration, and not just the outgoing administration, but whoever is the new county executive and his or her team next year, provide this county board with the information that it needs. We need to start working together. That's all.
Supervisor Decker?
I just want to answer Supervisor Rodriguez's question and say that I concur with Supervisor Belsky and Gully that the information that we should have been given to us was not. And then when we had questions about it in committee, we were looked at like, how dare we ask questions and ask for where this money is actually being spent? And if the money was presented tonight of how it was spent in committee, why isn't it in our packet? Why do we still not know where, aside from the Finance Committee, why do we still not know where this money is being spent? Why wasn't it sent to the full county board? Why isn't it in our packet? No one has an answer? Doesn't surprise me.
Finished? Anybody else? I see no other lights. Supervisor
Chairman.
Did you have your light on?
Yes, I would like to have the health director enumerate the expenditures that are listed in the resolution and what the various components are going to be used for here in Kenosha.
Hi, can you hear me? Thank you, Dr. Freiheit. Thank you, Chair and members. There are 3 separate pools of money. The reason why they were put into one resolution is because they all revolve around COVID response, and they were all sent to us as sort of a package from the state. So this was not a grant that we applied for. These were, the algorithm is right, that it was based on population, and it broke down the money versus based upon operational tasks. So the first one is the Health ARPA. It's $1.2 million over 3 years to be spent on response and recovery efforts. Some of the things that we'll be spending it on is approximately $400,000 for our Patagonia new electronic medical record system. We also have some outdated lab equipment for approximately $150,000. We need 2 new medication dispensing units for each of our clinics. That's approximately $60,000. And the rest will be held in reserve in order to cover COVID testing, vaccination, recovery needs, response needs as moving forward over the 3 years, as we don't know where the pandemic will move in the future. In addition, we will evaluate all additional capital costs that can be covered by this to avoid future bonding purchase needs. The second pot of money is the COVID-19 vaccination funding. This is $238,000 over 3 years. We already have incurred $100,000 plus that are eligible for reimbursement from this, and this was part of our summer and our early fall vaccination efforts as we were out in the community and providing vaccination that way. So this is strictly on vaccination. Actual cost to administer vaccine, meaning reimbursement of time and supplies. We're looking at having this be a team moving forward so that we can essentially get our health department staff who are spending all of their time on COVID back into public health work as well, while still being able to continue these vaccination efforts. And we're also looking at, we have had in our response plans a potential collaboration with the fire department and EMTs who can vaccinate. It's always an issue of paying for their overtime and funding for that. So we're looking at their assistance as well to help with future vaccination. The third pool of money is for CDC workforce development funding. This is very specific to our statutory requirement to follow up on all communicable diseases. So this entails the staffing of disease investigators and contact tracers to keep that statutory requirement going, much as we have for the past year and a half. So that's $212,000 over 2 years.
Anything else?
No, nothing else. I think that answers the question, specifies why we should support the resolution.
Thank you. Supervisor Gens?
I just want to add one thing. We did ask the health director to come back to finance to give us in about 6 or 8 months an update on, with this plan, how the execution has gone, just so for the county board's benefit. We have asked them to come back and show us what it looks like from the plan later. So just want to let you know that. Thank you.
Supervisor Rodriguez?
Thank you,
have a
Mr. Chair.
question?
Through the chair to Director of Health, just going through the numbers that you gave me, or through the chair to the Director of Health, just going through the numbers that you gave us all. The first pot of money is $1.2 million. You identified $610,000, which would leave $623,500 left that is not allocated for. Are you able to spend that money without coming back to the county board? Are we giving you that authority tonight?
I'm sorry, could you repeat that last part?
Are you able to spend the remaining $623,500 without coming back to the county board? Or will we, I don't just want an update after it's spent, but does the county board get say in what it's spent on? Or are we allowing you tonight to just spend it?
So it's a reserve pool of money as cases rise and fall so that we can be able to add additional staff, add additional resources to be able to handle the pandemic as it continues on.
So no. The county board will not get a say on how it's spent.
Restricted by the requirements from this. If I may, ultimately, we are restricted on what we can spend that money on based on what the state is telling us we can spend those dollars on. So yes, you have very little say because we're getting our directions from the state to use it for vaccination clinics and things along that line.
And do we only, so it's this money, that first amount is over 3 years. Do we have to use it within each of those 3 years? Or does it
It's
roll
for
over?
a total 3-year period.
If we don't spend it in 3 years, is it gone?
I believe it'll probably be absorbed back. I don't know what the state's plan would be for those dollars.
And is that would that be the answer for the other two funds as well, the 238 and the 212?
Yes.
Okay. And are the other two as restricted as the first?
Yes, they are.
Okay. All right, again, I just want to echo the need that we need to start getting this beforehand, but through the chair to Supervisor Gens, I appreciate your committee doing its due diligence and getting answers for us tonight. Thank you.
Supervisor Gully?
Oh, no, sorry.
Okay. Seeing no other lights on, this requires a 2/3 vote. Roll call.
Motion passes 22 yes, 1 no. The approval of the October 19th, 2021 minutes by Supervisor Gantz.
Supervisor Gens,
Mr. Chairman, I move the minutes for October 19th, 2021.
motion by Supervisor Gens, second by Supervisor Rodriguez. All those in favor? Aye. Any nay?
Move to adjourn. Sin die.
All those in favor? Any nay? Call the annual meeting to order. Roll call.